breast cancer mammography screening as a topic of discussion boards. What has been the impact of COVID-19? I'm T.L. Brink. My colleagues are Victoria Carolyn, Amber O'Brien, Bobby Valdez, Reem Sarsour, Bianca Mabita, and Lady Arango Beloit. There are many different kinds of cancer, and each kind of cancer has its own risk factors, its own etiologies, its own techniques for diagnosis, and its own treatment protocols. Breast cancer is the most commonly diagnosed cancer in the United States and around the world. In treating breast cancer, the attitude of friends and family is extremely important to provide the knowledge and emotional support that patients need to get proper diagnosis and treatment. We know that any kind of delay reduces the survival rate by as much as 25% for each month of delay. And so the general model of patient delay is certainly important in this area. Delay can occur at any stage of the assessment or treatment process. One very important step is mammography, but many patients find it to be embarrassing or painful. A further problem is that mammography produces false positives many times, and these can lead to unnecessary treatment. COVID provided another problem with this process of patient delay. We know that in-person visits were down 25% during the first few months of the COVID lockdown during 2020. The guiding question we had in our research was, did the COVID-19 lockdown influence the Internet discussion board posting on breast cancer and mammography? We had a specific hypothesis. Internet discussion board posts about breast cancer screening and mammography will show a decrease during the COVID-19 lockdown. Our method was to utilize BoardReader, a search engine for Internet discussion board posts. It can go back 2 years, and it will look at the archive of traces of discussion activity. These can be analyzed quantitatively or qualitatively when we look at the actual words in the posts. Our quantitative design was sample versus norms. We used the observed frequency of posts versus the expected frequency that would be expected, assuming that 2 different time periods involved a random distribution of the total number of posts. Our procedure was to select these 2 time periods. We had the period of the COVID lockdown, the 10 months, March through December of 2020, and for a comparison pre-COVID period, we looked at March through December of 2019. We looked at these 2 search terms, mammogram and cancer, and our data analysis involved the descriptive statistics of percent change, and we then used the Vassar-Stats site to calculate our inferential statistic. We found that in the pre-COVID period, there were over 12,000 discussion board posts on mammography and cancer. But during the COVID lockdown, that number went down to slightly over 9,000. That is a decrease of 24%, which is highly statistically significant. One of the functions of Board Reader is that it can give a monthly summary of volume. Here for 2020, we see that the greatest impact, the greatest suppression occurred during March, and the rest of the year was a slow recovery back to higher levels of discussion about mammograms. We can also chart daily spikes of interest in a particular topic. During the time period of the last year or so, we have seen spikes during particular days, like March 24th, when Harvey Weinstein was convicted of rape and Kobe Bryant had his memorial service. The greatest spike occurred on March 19th of 2020. Now, why people were searching for mammograms that day is hard to say, but we could not find a specific topic in the news or on Twitter that might explain the peak of interest on that particular day. Let's take a look at the qualitative analysis of some of the posts that Board Reader helped us find. Here's what one woman said. My diagnostic mammogram and diagnostic ultrasound got canceled. Sucks. Is it because of COVID? So in her case, the decision was clearly made by the clinic, not by her. Here's another example. I have an appointment this morning for a mammogram, and I'm only doing it because I do whatever my GYN says, since I need birth control, not that I've been having sex, thanks COVID. So here we have an example of a woman who's not really interested in the mammogram, but is doing it as a kind of compliance. And here's the last one. The COVID-19 vaccine can lead to a false positive mammogram. Now, how true is that? I don't know. But this woman thought it was an important factor for her to delay her mammogram because of this possibility. If we look at the different models of healthcare utilization, one that is frequently utilized is the Anderson model. It's been around for over half a century. And it says that healthcare utilization is determined by an interaction of patient need, as well as both predisposing factors and enabling factors. And clearly, we could see the COVID as something that would enable patients to get out of doing their annual mammograms. Now here once again, the attitude of the family is a major factor. Are they going to continue to push and remind that woman to go ahead and get that cancer screening? Another model that we think may be very relevant to help us understand the decision-making procedures here would be the Eisenhower model, something that the president developed back when he was a general in World War II, but used extensively during his time in the Oval Office. He would classify everything that came across his desk as urgent or not urgent, important or not important. That which was both urgent and important was on his immediate to-do list in quadrant 1. Now, under normal conditions, regular, periodic breast cancer screening is important and probably urgent as well, and would be in that top left quadrant, something that should be done and done right away. Now, under the COVID restrictions, we're going to see that the situation changes. It's still important and perhaps urgent, but maybe now it conflicts with other priorities like avoiding COVID or staying at home and taking care of the kids. So maybe now it is of less relative importance because it conflicts with other priorities. And so maybe a rational approach would be to move it to one of the other quadrants involved, such as the quadrant of maybe plan for the future. Delay now, plan for later. Now, another possibility, in addition to delaying the scheduled mammogram, may be to try to move it to quadrant 3, where we delegate this decision to somewhere else, such as letting the physician make the call about whether a mammogram is needed now at this point in time, given the risk factors associated with COVID as well. Unfortunately, we fear that many women chose a rationalization approach as different from a rational approach, and simply moved this decision about the mammogram into quadrant 4 and pushed it out of mind. They eliminated thinking about getting a mammogram and labeled it as if it were not important and not urgent. We think that future studies must use qualitative research, such as focus groups, in addition to the quantitative approach. We think focus groups are an excellent way to help us explore the process of how subjects make decisions in this particular area. I'm T.L. Brink from Crafton Hills College.